Come in.
Hi, my name's Beverly. I'm going to be your nurse today. Can you please verify your name and birth date for me?
It's Sean, 03/16/1980.
And your last name?
Wallace.
All right, Mr. Wallace, before we get started, I'm going to go wash my hands, okay?
Okay.
Okay. So I'm here today to do a physical assessment on you.
Okay.
Is that all right with you?
Yeah.
Okay, are you comfortable? Room temperature is okay?
Yeah.
Don't need a blanket or anything?
No, I'm good, thank you.
Okay. So first thing we're going to start with is a general overview. Just look at the patient. Notice if there's any respiratory distress, any difficulty breathing, skin color is pink. He doesn't appear to be in any distress at all. He's well groomed and nourished. Skin distribution is normal with a little bit of lacking distribution up on the top of the head there. We're going to check the skin temperature. We just use warm and dry all the way down with the back of the hand. Take a look at the hands, front and back. Noticing if there's any change in the angle of the nail beds for clubbing or any cyanosis or decreased capillary refill time. Everything looks normal there. So we're going to then step and move towards the cardiac portion of the exam. So first thing we're going to do is just inspect the chest, and we look and see if there's any deformities. We can visualize our apical pulse here underneath the mid-clavicular line in the fifth intercostal space. Other than that, we don't see any abnormalities. Next thing we're going to do is palpate. So first we'll palpate right underneath in the fifth intercostal space for the apical pulse, and we can feel that normally. We're also going to palpate both sides on the sternum and here, and then also up above here. We're going to check for any type of nodes or nodules, see if we feel anything abnormal, and also feel for any type of subcutaneous emphysema up here, which I don't feel any of that. Next, we're going to go ahead and auscultate. So we're going to start up here in the top in the second intercostal space, just right of the sternum. And if you can just breathe normally for me, we're going to listen to your heart sounds. So here we hear a normal S1, S2, with the S2 being louder. This is the aortic valve that we're listening to. Second, we'll move over to the right side in the second intercostal space. And again, S2 is greater than S1, and we're listening to the pulmonic valve. Then we're going to move down to the third intercostal space, just left of the sternal border. Here is our Erb's point. S1 and S2 are fairly similar here. Next, we're going to move down to the fourth intercostal space. We're listening to our mitral valve. And here our S1 is greater than our S2. And lastly, we're listening in our fifth intercostal space. And again, the S1 is greater than the S2 here. We can turn over to the bell and listen in the same areas for any bruits, which are not heard on auscultation. So in the assessment of the chest, we did the palpation. There was no heaves, lifts, or thrills noted, no bruits noted on auscultation, and heart sounds were normal S1, S2 heart sounds. Next, we're going to move to the respiratory assessment. First thing we're going to do is inspect. We're going to look for respiratory rate, depth, ease of respirations, and the configuration of the chest. We're going to look here and in between the ribs and the intercostal spaces for any kind of retractions. There are none seen here. We're going to note that the anterior-posterior diameter is 1 times the front diameter. The lateral diameter is 2, so you should see a 2 to 1. There's no barrel chesting noted for hyperexpansion of the lungs. The second thing we're going to do is we're going to palpate for any masses or symmetry. We've already done the front, so if you can turn to the side a little bit. we'll go ahead and do the posterior portion. So we're going to just start at the top. We're going to feel our spinous process all the way down. Everything feels normal. We're going to palpate the back of the lungs for any abnormalities. We can check for our lung expansion by placing our hands on the back of the chest. I'm going to have you take a deep breath in and out. And once again, in and out. Good. And we should see normal symmetrical movement on both sides. We're also going to check for tactile fremitus. In order to do that, I'm going to have the patient say 99 while I place my palms on his chest or on his back here above his lung field. So go ahead and say 99 for me.
99.
And again.
99.
And again.
99.
Good. And one more time.
99.
And both sides should be symmetrical. You should be able to feel the vibrations. Any areas in which you could not feel the vibrations could identify some type of consolidation, which is not noted in this exam. So the next thing that we're going to do for the respiratory assessment is we're going to do some percussion and listen to the quality and symmetry of the lung sounds. So I'm just going to place my hand on his back here, and we're going to percuss all the way down, starting at the apex and moving towards the bases. Should be resonant all the way down. Any areas of dullness could represent consolidation, and any areas of super or highly resonant areas could represent any trapped air, which could mean like asthma exacerbation or air trapped in the respiratory system. The last thing that we're going to do when we listen to the lung sounds, we're going to listen in the front and the back and listen for any type of adventitious breath sounds such as crackles or wheezes, and we're also going to check for egophony, whispered petriloquy, bronchophony, and any kind of friction rubs. So first we're going to start up in the apex again, and again we would be doing this on front and back. So go ahead and take a deep breath for me. Let's do that again. Good, and again. Again. We're going to do this in a ladder shape. All the way down. Good. And then in the lateral underneath the axilla. Good. We're also going to repeat this in the front. One more time. Good. Okay. Now, in order to assess for egophony, we're going to have the patient make an E sound while we're listening with the stethoscope. What we should hear is the sound should come through normally. If the E changes from an E to an A, then there's some type of abnormality that could be going on in the lung fields. So I just want you, when you feel my stethoscope touch you, to go ahead and make an E sound.
E. E, 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 E.
Okay, so all those sounded normal. We're also going to do the same thing, but I'd like you to say 99 for me.
99, 99, 99, 99, 99, 99.
Okay, good. And with the 99 sound, you should hear a muffled sound and not be able to distinctly make out the formation of the 99 in a normal test, and that's what's heard here. So the next thing we're going to do, the last thing is the whispered petriloquy. So I'm going to listen one more time. I want you to whisper very quietly, 1, 2, 3. Okay, so go ahead. And again. And we should not be able to hear those sounds resonate through, which we did not. And that would be a normal finding. We would complete those 3 tests on the front as well. The next thing we're going to do is move to the vascular examination. So if I can have you go ahead and lay on your back with your head on the pillow. And we're going to examine for all the pulses. The first thing we're going to look at is the jugular pulses. We're going to lean the head back, have you turn your head slightly to the other side. You can visualize the jugular pulse here and the carotids. So it's about a 2+, no bounding. You see the jugular vein is not distended. And we've got the normal carotid pulse on this side. You're going to do the same thing on the other side. Have the patient turn their heads toward you. Place your hand above the sternal notch. Feel for the carotid pulse, and it's normal on that side as well. The second thing we're going to do is move down the arms here. We're going to grab on each side of the elbows and feel for the brachial pulses. Both pulses are equal and 2+. We're going to come down to the radial pulses. Check them on both sides. And again, both pulses are 2+. As we move down, we're going to bend the patient's leg. Place your foot on there you go, flat on the table. We're going to take our thumbs around this side, reach around, and you should be able to, in the center, feel the pulse behind the knee here, the popliteal pulse. Good. And on this side. Good. You can go ahead and drop both your legs down. And we're going to feel for the posttibial pulses on both legs, and both of them should be equal, 2+ on both sides, as well as the dorsalis pedis pulse, which is, again, 2+ and equal on both sides. The last thing we're going to do is we're going to inspect and assess the abdomen, which we did in the last video. So first thing we're doing is, again, looking at the chest for any pulsations, scars, bruising, anything abnormal that could indicate hernia or other abnormal findings. The contour on this patient is normal. There's no masses or pulsations noted. So the next thing that we're going to do is we're going to auscultate in all 4 quadrants, starting with the right lower quadrant and working our way around. Now, once we hear normal bowel sounds in each bowel, in each quadrant, we can stop there. But if there were no bowel sounds, we would need to listen for 5 or more minutes to make sure that we can call that absent. So you can just breathe normally. I'm just going to take a listen to your abdomen. These good bowel sounds all the way around. And while I'm here, I'm going to go ahead and flip over to my bell and listen to my aorta. And the renal arteries. The next thing we want to move to is palpation. So we're going to palpate both light palpation and then deep palpation. So on light palpation, please let me know if you feel any pain anywhere that I'm touching you, okay? So we're going to lightly palpate all the way around. Notice for any grimacing or discomfort, anything. And then we're going to move to deep palpation. We're going to push a little bit further down. You can feel the upper quadrant of the upper border of the liver underneath the rib cage here. Take a deep breath in and out. And you're going to feel for the bottom border of the liver. Or feel over here. Have the patient take a deep breath in and out. And that's where we would be checking for the spleen. Usually you can't palpate the spleen. So no discomfort noted? No. Okay, good. The last thing that we're going to do is percuss each quadrant. So in the lower part of the abdomen, where the intestines are, we should have resonant sounds. And then as we percuss over the liver and over the spleen, it should become more of a dull sound. So all 4 quadrants are resonant. And we've got dull sound and dull over the spleen. Now that we've done the abdominal assessment, I'm going to have you turn around. And I'm just going to check for any costovertebral angle discomfort. So just let me know if you feel any discomfort. Anything?
No.
Good? All right. Okay, Mr. Wallace, everything checked out just great. We're going to see you a little bit later, and I'm going to go get your assessment findings documented, okay? Thank you again for participating.
Thank you.